Good morning, ma'am. I am Marcel Dininas, student nurse of Davao Doctors College, and I'm going to perform the Leopold'S maneuver. But first, let's define what is it. Leopold'S maneuver is a four systematic steps or method of observation and palpation of the woman's abdomen. This is to determine the fetal lie, position, presentation, and attitude, and to determine the number of fetuses. And this is also to identify the point of maximum intensity of fetal heart tone in relation to the woman's abdomen. This is necessary because it will serve as an indicator whether the pregnancy will be delivered normal or whether cesarean section is needed. Prior to performing the procedure, it is necessary to wash the hands first. This is to deter the spread of microorganisms. Before explaining the procedure to the patient, introduce self and verify the patient's identity using the two identifiers, the patient's full name and birth date. This is to establish rapport and ensure that you are doing the right procedure to the right client. And after that, explain the procedure to the patient, and this allows patient's cooperation. Good morning, ma'am. I am Marcel Diaz, your student nurse for today. May I know your complete name and birthday, ma'am? Thank you. I'm here today to perform Leopold'S maneuver. This is to determine the position of your baby inside your abdomen. And in order for me to do that, I have to place my hands on your abdomen. Is that okay, ma'am? Thank you. Provide for patient's privacy. This is to ensure patient's comfort. If you are in a closed room, just close the door, and if not, just close the curtains or screen the patient. And since I am in a closed room, I will just close the door. Let the patient empty her bladder first before the procedure. Ma'am, do you want to use the bathroom first? No? Thank you. A distended bladder may deviate the uterus, and this promotes comfort and allows more productive palpation because the fetal contour will not be obscured by a distended bladder. Position the patient on supine with one pillow under her head and with knees slightly flexed or in a dorsal recumbent position, and don't forget to expose only the abdomen and put a rolled towel or small pillow under the patient's right hip. Okay, ma'am. Please. Let's just assume that the patient is in a dorsal recumbent position. Proper positioning of the patient facilitates accurate assessment and provides patient comfort. And with knees slightly flexed, it relieves the tension of the abdominal musculature, and exposing only the area to be examined maintains patient's privacy. And putting a rolled towel under the patient's right hip to prevent the supine hypotensive syndrome and to shift away uterus from the large blood vessels. If right-handed, stand at the woman's right, facing her. Since I am right-handed, I will stand on the patient's right side. This is to easily grasp the symphysis pubis to be done in the third maneuver. Face the patient and palpate the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. Or, this is the first maneuver, which is the fundal grip. It is a palpation of the fundal area to determine what part of the fetus lies in the fundus. It could either be the fetal head or the breech, and this is to determine the fetal presentation. Expose only the abdominal area and warm hands first before placing them over the abdomen because cold hands may stimulate the uterine contractions. So, hanap tayo magpiyay. And warm hands. Okay. Expose only the abdomen area and warm hands first before placing them over to the woman's abdomen because cold hands may stimulate the uterine contractions. And there are important points to remember upon palpating. The head feels more firm, hard, round, freely movable, and palatable, while the breech feels softer and nodular. Palpate in a downward direction on each side of the abdomen, applying gentle but deep pressure to determine the fetal extremities, the fetal back, and the anterior shoulder. It is the second maneuver, the umbilical grip, used to identify the location of the fetal back and determine the position of the fetus in relation to the mother's left and right side. Take note to palpate with one hand steady on the other side while the other hand is exploring the other side. And remember that the fetal back is smooth, hard, resistant surface and a long continuous structure will be felt, while knees and elbows of the fetus filled with a number of angular nodulation. Next, I'm going to place my hands on each side of the abdomen while my left palm is stationary on the left side of the abdomen to steady the uterus, while my right palm palpates the right side of the abdomen on a circular motion from top to lower portion of the uterus, applying gentle but deep pressure to palpate the fetal back in small parts. And after that, on the other side, place one hand over the symphysis pubis and grasp the lower uterine segment between thumb and fingers to feel the presenting part. This is the third maneuver, the pollux grip, used to determine the presenting part and if engagement has occurred. Using the thumb and fingers of the right hand, grasp the lower portion of the abdomen above the symphysis pubis, press lightly, and make gentle movements from side to side. For the findings, if the presenting part is still movable, it is not engaged. But if the presenting part is not movable, felt as relatively fixed, numb-like part, it is engaged. If it is firm, it must be the head. But if it is soft, it could be the breech. Turn and face the woman's feet to confirm the findings of the third maneuver. This is the last maneuver, the pelvic grip. This is used to determine the degree of flexion of the fetal head and to determine the attitude or habitus. And for the last grip, I'm going to stand at the right side of the patient but facing the patient's feet and use my both hands, place it low on the lower part of the uterus, then palpate it by pressing downward about 2 inches above the inguinal ligament. And palpate using the palm. For the findings, prominence on the same side as the small parts suggests that the head is flexed, and prominence on the same side as the back suggests that the head is extended. And remember that this last maneuver could only be done if the presentation is cephalic. Locate again for the back of the fetus and place the stethoscope over it and listen for the fetal heart tone for 1 full minute. Note its location, rate, and character. Since the fetal back is located at the right side of the abdomen, I'm going to place the stethoscope on it for accurate assessment. And I'm going to use the bell for accurate findings and start the time for 1 full minute. And before that, check that the stethoscope is on. Okay? And start the time for 1 minute. In cephalic presentation, fetal heart tone can be heard on either left or right side of the lower quadrant of the abdomen. If breached, fetal heart tone can be heard above the level of the umbilicus on either left or right side. And based on the assessment, the fetal back is located on the right side of the mother's abdomen, and so is the fetal heart tone. And the recorded fetal heart rate is 135 beats per minute and is strong and audible. Make patient comfortable to ease and promote relaxation, and explain the results of the assessment using language that they can understand. Ma'am, the procedure is done. Ma'am, the procedure is done. Your baby is in the cephalic presentation, which means that your baby's head will be the first to pass through your cervix and be delivered. In vertex type, since the prominence is on the same side as the small parts, which means that the baby's head is flexed, and the fetal back is located at the right side of your abdomen. And do you have any questions, ma'am? Thank you. Document observation made, the fetal presentation, position, attitude, or whether engaged or still floating. This is the promote database for the future. And lastly, do hand washing to deter the spread of microorganisms.